Hello?
Hi, we'll start momentarily. Just waiting for the rest of the panelists to join.
Mel, did I go on the wrong one?
No, you're all set.
You have me muted. Is that okay?
Yeah, everyone's muted for now. Thanks.
Okay. Sorry. Eric
It's
was sending
okay.
me a text simultaneously. I wanted to make sure I was on the right one. All right.
No problem. Hello, everyone. We'll begin momentarily.
Right.
Am I unmuted? Looks like my video's off.
Yeah, my video is saying you have to turn it on.
Okay, just give me one moment.
I think we're okay. There you are, Mel. We see you.
Of course. Let's see.
I see Claudia too.
Water. Give me one moment. I'm just trying to find out where the issue is.
Do you want
Good
us to,
night.
do you want us to log off and log back on, Melissa?
No, that's okay. I think it's just a setting and I'm trying to fix it. Okay, try now.
Yep. Hi, Melissa. I'm Claudia.
Hi,
I
Claudia.
don't see the option here to switch to the translation room like I used to see it. So I don't know.
It shows you as the interpreter. Hold on. Let me take you off and then I'll add you again.
Okay.
Claudia?
And now I'm on.
To
Hi, everybody.
Spanish. Okay, did that work, Claudia? Okay, that should have worked for Claudia. Okay. Just give me one moment. I'm just making sure everything is ready to go.
Yeah, I think we're good. Oh, maybe a couple minutes
Okay.
behind.
Okay.
Okay, there we go.
Okay. Alrighty. Good evening and welcome to tonight's live Q&A. Before we get started, I wanted to let everyone know that there's an interpreter available to translate for those needing Spanish translation. Si hay alguien que necesita traducción en español, seleccione el botón de traducción en la parte abajo. Se muestra aquí, momento. Sorry, guys. Aquí si necesita traducción. Okay, tonight we'll be hearing from our group of panelists who will be answering questions sent in by parents and guardians of East Haven Public School students. These questions range from questions pertaining to in-school learning, safety, and other areas of inquiry and concern that have arisen since the beginning of the school year. In light of the current pandemic and health concerns, we know many parents have questions. Our hope is that our panelists this evening will be able to answer the questions sent in advance. I will now ask the panelists to introduce themselves and let us know what their title is and briefly tell us how they serve the East Haven community. So we'll start with Mike Pascucilla. Sorry if I butchered that.
Oh, absolutely, you did well. Good evening, folks. My name is Michael Pascucilla, and I'm the Director of Public Health for the town of East Haven. So my role as a local Director of Health, along with my team, is to school system through the COVID-19 situation. And as we have in the past, we work on a variety of issues to keep East Haven health safe. And again, we do this in partnership with the Board of Education.
Thank you, Mike. I'm going to be muting everyone while other people are talking just so that we don't hear any outside noise. Next is Dr. Riccio.
Hi, I'm Dr. David Riccio. I'm the Supervising Director of the East Haven School System.
Thank you, Dr. Riccio. Dr. Oldfield.
Hi, everybody. Good evening. My name is Dr. Benjamin Oldfield. I'm a pediatrician and the Chief Medical Officer at Fairhaven Community Healthcare. We have sites in East Haven, and we also staff 2 of the school-based health centers at East Haven schools. I'm happy to be here with you tonight.
Thank you, Dr. Oldfield. Nurse Betty Davies.
Hi, I'm Betty Davies. I am the nurse coordinator for East Haven Public Schools. I am also the school nurse in the Overbrook building for pre-K, East Haven pre-K.
Thank you, Betty. And Bob Swan.
Good evening, everyone. I'm Robert Swan. I'm the Director of Pupil Services for the East Haven District. I'm responsible for students with disabilities aged pre-K to 21. Thank you.
And our superintendent, Erica Forti.
Hi, good evening, everybody. Erica Forti, Superintendent of Schools. I'd just like to thank our panelists in advance for your participation this evening and for sharing your knowledge and expertise with us on behalf of the students and families in East Haven. And Melissa, in advance, thank you very much for facilitating this panel.
Thank you. Okay, so what we're going to do is I'll be asking some questions. I will basically say your name when the question is directed at you. And then if it's a question posed to everyone, I'll just say your name and you can kind of answer briefly. So the first question is, what is your opinion on the district's current learning model, and should we stay in person with a remote option? So I will start with Mr. Mike Pascucilla.
Okay, so first question, can you hear me okay?
Yes,
Yeah? Okay.
I can, yes.
So in order to understand the model we're in, we have to go back in time. So over the summer, we met with the Board of Education and Erica's team to look at the different models. And what we decided is that full in-person was the model that we're going to use. And so we put together a plan, and it was based on what the Department of Public Health and the Department of Education gave us for guidance. And so we got their guidance and we enhanced it. And so right now we have a great plan that involves contact tracing, where we're able to put people in quarantine and isolation, and we do it very, very well. We have regular seamless communication. And so the model that we're in at this moment in time is working very well, and it's working for our students. Yes, we get some cases, but it is the right model to be in at this time.
Thank you. Dr. Riccio?
Hi, everybody. I really like the model we have. I like having the students in 5 days a week. I think they learn better than the video from what I'm seeing. I think the socialization is very important for the students too. And statistically, the schools are showing to be very, very safe. The statistical averages of cases per our population are way lower than the overall state. So I feel very confident that the students are safe in school. And again, obviously, I think it's much better for the students to be in school 5 days a week with their learning, their socialization, and their general mental well-being.
Thank you, Dr. Riccio. Nurse Betty?
I totally agree with Dr. Riccio's, what he had said. And also seeing it firsthand in the schools, I can see that it's working very well. You know, I know some children are having a lot of trouble trying to do it from home, but I think most importantly, it offers the parent who's uncomfortable with the full day time to have an option to have their kid learn. So I think that the way we're doing it now, in that it's all in school or all at home, is safer option than to be doing hybrid. And I think our children are benefiting from being in school.
Thank you. Where are we? Dr. Oldfield?
I wholeheartedly agree with what others have said. I think that as a pediatrician who sees patients in the clinic of all ages, I certainly acknowledge the important role of school in the lives of not just a child, but of a family, as a place that provides structure and socialization, as has been mentioned, and opportunities that really cut across all types of people and all kinds of families. And I think that the ability to go to school every day is extremely important. And I like this model because it also gives, as has been said, that option for those families who decide to do at-home learning, the option to do so.
Thank you. Bob? You're muted, Bob.
Sorry, Melissa, I thought you were unmuting me.
I tried. It only lets me ask you to unmute.
I think, we have to consider, at least from my, in particular, my office, Erica's office, and Jennifer's office, as well as the principals, the risk and well-being that arise when schools do not open for in-person classes, the potential for the adverse impact on students' social, emotional, behavioral, mental health needs, as well as the critical services we provide to students that mitigate health disparities, serve children in need, such as school lunch programs, special education services, extracurricular activities, and mental health, sometimes go unnoticed, but they're critically important component of our day-to-day efforts. Thank you. Mute myself now. Melissa?
You can. I can mute you too. Erica?
Thank you. So the current model is supported by the Department of Public Health and East Shore Health, but what I think is really great is it does give parents an option, right? So, and a choice. And so if you're comfortable and you think that school is a safe place and you want to send your child to school, you have that option. If you have extenuating circumstances at home, and we totally value and respect that, you have the choice to keep your children home and they can live stream in and access instruction that way. Moving to a full remote model or anything like that takes away that choice for parents. And so as we monitor things, allowing people to have that choice in the model that we're currently in is important to us. So, I think we can move on, and I think some other points that I was gonna make here, I can make in some of the other questions that parents have submitted in advance.
Thank you, Erica. Okay, so the next questions are for Mike and Erica. The question is, can the superintendent provide an update on what are the factors considered in making the decision to move to distance learning? What are the measures that she looks at to make this determination? It would also be helpful to share how we compare to these measures and how far or close we are to moving to distance learning.
Erica, you want to go first? You want me to go first?
You can go, Mike. That's okay. Speak up, though. We can't hear you very well.
So you can't hear me. All right, let me turn up the volume. How's that?
Better.
Is that better? Okay. All right, so a lot goes into whether we move to a hybrid or a remote learning. And so what we do is every week we review the data, right? So we have a standing meeting with the town of East Haven's leadership. It's through the Incident Command System, also known as ICS. And this is important to know because we've been doing this since the beginning of the pandemic. We review federal, state, COVID guideline. We look at the state data, and more importantly, we are analyzing local statistics. We're looking for trends and opportunities to better control the pandemic in our community. And two of our main focus. One is school and two are nursing homes. And so at this moment in time, if we look at the matrix we're in, it is safe. And let me be very clear, if our schools were not safe, as a local health director, we wouldn't allow it to be open, nor would the town leadership or the school district. And so at some point, if for whatever reason the cases continue, or if we see community spread within the four walls of our school, then we would have to take a pause. But to date, we have not seen any community spread within the four walls of our school. We have contact tracing down. We're able to isolate. We have quarantine. We do it very efficiently. And so it's a week by week basis. Every week we assess. And again, we look at what's happening in the community. We see what's happening in the schools. And as long as we're not seeing spread within the four walls of the school, and we're able to keep up with contact tracing, the school should stay in a full learning model, because again, based on what you've heard, it fulfills not just the education, it's much more than education. It fulfills the social, emotional, nutritional and physical needs. And from a public health standpoint, the schools serve the whole child's wellness. So it's really important that we keep our schools open. But again, if we cross that threshold based on science, based on data, we will definitely make that decision to pause and look at a different model.
So Mike, I had some of the same things regarding keeping up with the contact tracing and also having enough staff to properly supervise and engage and instruct our students. But one of the other pieces of data in our weekly meetings that I think helps us also inform our decisions outside of, you know, the number of cases that we're having in schools and the fact that the spread is not happening in schools is the percentage of positive cases by age group. And we've seen very consistently over the past several weeks that, you know, including this month for November, that only 11% of the positive cases for the month of November thus far are in children from ages 0 to 18. And that 90 or 89% of the cases are in ages 20 and up. So I think that's also another key data point that we also assess and look at outside of, you know, the number of positive cases in school, contact tracing to make sure that transmission is not happening in school, being able to keep up with the amount of contact tracing, and also some of the staffing issues.
Agreed. Yes, looking at the data and seeing where the cases are. And right now, at this moment in time, we're not seeing a significant amount of cases within our youth. Yes, we get some cases and we do have some ebbs and flows, but right now at this time, it's low.
Thank you. The next question is for Dr. Riccio, and Mike, if you'd like to comment on it as well. Some parents feel that you're putting a lot of people at risk, and this is the concern of many. What can you say in response to this? Oh, Dr. Riccio, you're unmuted. There you go.
From looking at statistics through the state, through the schools, basically what Michael said about what the parameters they look at, from what I've seen and analyzed about these statistics, school is the least risk. Kids being in school is a lesser risk than them being home or out and about on the weekends. I think the safest place they can be is in school, again, because the number of students getting ill is very low. And so I don't think it's a risk at all. There's a slight risk to everything, but I think that the risk is small and smaller in comparison to the community. And I think the best place the kids should be is in school.
Thank you, Dr. Riccio. Mike, did you want to add anything?
Sure. So, let's start off. We're in the middle of a pandemic, and we are seeing people get sick, right? We got to acknowledge that, and we have seen some cases in our school. But if you look at the statistics and what the Department of Public Health and the Board of Education just sent out to all the superintendents, they made it crystal clear that the school is the safest place that children can be right now. And when we talk about the children, we also have to acknowledge the staff. It's a safe place for our staff too, and our teachers, right? We've implemented lots of controls. So it's not just the teachers, not just the staff, it's the teachers, it's the administration. It's a very controlled environment. If we go overseas and we look at the European model, right? So in the European model, they've made the decision that they've closed everything else, similar to what we're seeing in Connecticut, but we're keeping our schools open. And we need to do that for our families. We need to do that for our children. And so you have to look at the data. You have to look at the statistics. That's what drives our decision, the science. And the science tells us that it is best that we keep our kids in school. Again, we're not seeing spread. If we have children at home living a sedentary lifestyle, and there are opportunities for them to engage in a different mode of learning that most kids don't adapt to very well. We know that, the science tells us. Some do, but most don't. It is best that they stay in school. Now, we may have to go to that model at some point, but right now we have to make our decisions based on the science, based on the statistics.
Thank you. And then a question after that is for Dr. Riccio and Mike as well. Just to kind of go over, what are the determining factors whether there is community spread versus in-school transmission?
Mike, I'd like you to go first on that.
Sure. So we are seeing community spread. So our numbers, not just in East Haven, but in our surrounding towns, our state, our country, the numbers are going up, right? And so community spread is when people are not following the rules. They're not wearing face coverings. They're not social distancing. When they're sick, they're out and about. In school, that is not allowed. The rules are followed. When we do contact tracing, when we put people in isolation, and so isolation means they're sick. Quarantine means they've had contact with someone who has been sick. So there's a big difference between the two. We ask questions. We work with the school. We try to figure out where they are, what happened. And in every case, to date, we've always traced it back to community transmission, not school transmission. And that is a case across Connecticut, with the exception of a few cases.
Very good.
Across Connecticut, the epidemiology investigations of COVID-19.
Se hacen investigaciones del COVID-19, epidemiología. Esos son sonidos. Perdón.
That's exactly how I feel. Mike says is, as the health department watches where the case is coming from, who's infecting who, the infections are coming outside in the community. So the risk is higher there as opposed to being in school in a closed environment. So I agree with exactly what Michael said. It's safer to be in school.
Thank you. This question is for Superintendent Forti. What are the exact number of students quarantined? You're muted, sorry.
Thank you. We have 126 students currently in quarantine. And, just because a student is quarantined doesn't mean that they've tested positive. We're using that as a precautionary preventative measure when a positive case is identified, and putting students in close contact, and those students we decide to err on the side of caution in quarantine. If anybody is interested, we've recently put on our district website under the COVID-19 health tab a dashboard that tracks the cases that we've had this week, tracks cases cumulatively since the start of school 12 weeks ago, and also the number of students in quarantine. And so that's available. It's for public viewing, and it's located on our website under the COVID-19 tab off the homepage.
Thank you. Next question for Erica as well. Are remote students who test positive reported in the data?
So the district is responsible when we find out that a remote student has tested positive to report that to the Department of Public Health through a portal that our nurses access on a daily basis. But the remote students testing positive are not included in the data on our district dashboard. That's for in-person learners.
Thank you. The next question is for Superintendent Erica Forti and Mike. There's a concern that we are not following the plans set in September. Can you explain why these plans have changed or why we haven't gone full remote?
So, you know, when we first put the plan together back in July, the state had provided additional guidance on a matrix as a guide to help us determine learning models. I think Mike alluded to this in one of the opening questions that, you know, to much surprise, we ended up being in school a lot longer than we anticipated. And we realized that transmission wasn't happening between students at school being brought into the home. And so in realizing that, we determined that the mitigating factors like wearing a mask, keeping socially distanced, great hand hygiene, making sure we're 6 feet apart when our masks are off, you know, cohorting, foot traffic patterns, staggering passing periods, looking at different arrival and dismissal entryways and exits in our buildings, all have contributed to keeping the spread out from within our schools. Certainly we use that as a guide, and I know that, you know, East Haven, along with many other towns, are in the red zone. And every week we look at that, and every week we evaluate a collection of data in addition to that chart to make that determination. You know, as we see increased spread in the community, I know that it may result in increased spread in our schools, and at that point we may be forced to move into a different model. And we'll continue to consult with Mike at East Shore Health and the Department of Public Health and the State Department of Education to know when that time for a learning model switch comes.
Yeah, so let me be honest, when we first went through the planning phase, one of the biggest concerns that we had at the public health level, and we were having regular calls with the Centers for Disease Control, the State Department of Public Health, and my colleagues around the state, we're opening schools during a pandemic, and we've never done that before. And so we were concerned. And so what we have learned through this process is that, again, we're not seeing spread within the four walls of our school. As the pandemic has progressed, we've learned a lot. And so we put a plan together at the beginning of the pandemic when we didn't have all the facts. Things have changed. And so any plan, as you get more information, you have to tweak it. Anyone who's done a plan knows that at some point, sometimes you You have to tweak it. You got to put a little makeup on it, change it around, and that's what we've done. We're adjusting as the science and the facts come in.
And I had myself muted. Sorry. Thank you. The next question is for Nurse Betty. Why are children's temperatures not being taken in class each day in the morning?
Okay, to answer that question, in some schools, they are taken in each class every day. That's in the smaller elementary schools because it's a doable thing. There's a lot of children, and so the other schools, like say the middle school or the high school, it's more randomly done by the LPNs who we've hired to assist the RNs in our COVID mitigation factors. So, but I want to point out that elevated temp isn't like the most reliable, thing for COVID, and that parents should be checking their kids' temps at home also. But like I said, we have LPNs who are assisting with checking the temps. We have our teachers are very, very careful with their students. The least little thing, they get sent to the nurse, temperature gets checked immediately. So, I hope that kind of answers your question. But like I said, in the middle school and high school, there's just too many kids to check every single kid as they come in the door. So it's done randomly, and I hope that answers your question.
Thank you. Next question is for Erica. If a child wants to go remote for a few days, or parents want to have them stay home for a week or so, can they continue to do remote from home without any harm to their grades or attendance?
So that's a great question. And being in this model does offer us a little bit of flexibility. Certainly we want parents to err on the side of caution and keep their children home if they're not feeling well, and also keep their children home if someone in their household is exhibiting COVID-19 symptoms. And if you do that, students can absolutely access the live stream instruction for that day. In order to be marked present, they have to engage, they have to sign into the live sessions, and have to be completing the assignments in the Google Classroom. And being in this model affords in-person learners to sign on and continue their instruction, and if they're feeling okay and parents are keeping them home. What we don't want is we don't want parents to constantly switch back and forth. So if a child's not feeling well and for 3 or 4 days you're erring on the side of caution, you keep them home, that's great. We encourage you to send them back. We're trying to keep it so that you're identified truly as an in-person learner or as a remote learner, but certainly want to provide that flexibility if children aren't feeling well or parents want to err on the side of caution. And as long as they're engaging in the live stream and completing their work, they can be marked present for the day.
Thank you. The next question is actually for you, Erica, again. What will happen on a snow day? Will all kids be on full day remote or take the day off?
So at this point in the model that we're in, if we have a snow day, we'll cancel school as we usually do, and make up the day at the end of the school year. If we are in a full remote model and we don't have any in-person learning going on, we may have the option to continue school from home and have no need to cancel school for the day. We're still learning a little bit more about the criteria that the state put out regarding that, regarding having to provide food on those days, questions around some situations where storms may cause individuals to lose electricity or internet to go down. We have to make sure that we're making decisions, and when we make those decisions, everybody has an equitable opportunity to engage in learning for the day to count.
Thank you. The next question is for Dr. Oldfield. Will and when will East Haven receive the rapid test in-school option like Middletown District chose to offer? Do you need to be enrolled in the Sbhc to get tested? How will it, I know this is long, sorry. How will it be done in school, out of school, and will parents need to give consent prior?
All good questions. We are planning on implementing this rapid testing modality after Thanksgiving. And so the way it will work is that this test is really designed for people who are symptomatic. So this would be children who have symptoms that may indicate that they have COVID. So what would happen is that if a student is at school and develops a symptom of concern or symptoms of concern, they would be evaluated by the school nurse and the provider, the nurse practitioner at the school-based health center, who would then be able to order the test and actually perform the test. And for our sites, we are planning on actually doing the test outside. Some people have raised concerns about doing COVID testing inside and the fact that that could be a way of spreading the disease. And so for that reason, we've thought through ways to actually do the test outside of the school-based health centers. These results come back within about 15 minutes. And so I think for any of you guys who on the call have gotten COVID tested in other ways and had to wait for sometimes days to get your results back, this way of doing the test really lets us be laser focused on that contact tracing protocol that Mike has outlined, so that we can make decisions in the moment and give recommendations to families in the moment and think through who the contacts may have been and make recommendations to them. Good questions about consent. We always have to think about that with medical care for children. And yes, we will be asking for consent to do this test from parents or guardians prior to doing that. The question about enrollment in the school-based health center, to start, we are going to recommend that our clinicians do this for children who are enrolled. The good thing is that enrollment is not a very difficult process. So we can do it over the phone, electronically, and then when parents come to pick up their child after the test has been performed and the results are back, we can finalize that process. We're thinking of this sort of as a pilot, right? So we're going to try this for a couple weeks in the school-based health centers with the help of our clinicians there. And then depending on how it goes, we'll be able to implement this potentially on a wider scale.
Thank you. Next question is for Dr. Riccio. Can you comment on what your experience as a medical provider in the community has been relative to COVID-19? Oh, asking it. You're muted.
I am an internist in the East Haven community. So I'm dealing with more teenage adult patients. But in my own practice, what I saw in the summertime when we had the pandemic over a course of 18 weeks, we diagnosed 30 cases of COVID. In the past 6.5 weeks, we've diagnosed about 46 cases of COVID. So from what I'm seeing statistically, there's a higher spread, but you have to understand that we're definitely testing way more people than we did in the summer. I get 50 phone calls a day of people who want COVID testing or advice as to what they should do in terms of exposure. So the testing is so many more people are getting tested, so you're going to see more people. So statistically, that may not be relevant that I see more people now than I did in the summer. But in talking to the personnel in the hospitals are, the ICU is now filled. with COVID patients. They've expanded the ICU at Yale with COVID patients, and they're opening up third floor for more COVID patients. So my point is that the rebound is real. It's severe. You need to take it seriously. And so when I talk about the students being safer at school than out in the community, it's just that the community right now is in a pandemic state. And your students, your children need to understand this at home, that this is not a joke. This is very serious. Okay.
Thank you. The next question is for Nurse Betty, Dr. Riccio, and Bob. I will ask you to unmute in that order. My child needs to go to school. Do you think school can remain open even with cases rising in the community?
I absolutely do think so, because there's such a difference right now in the numbers out in the community, the percentage rate and the percentage rate that's in the schools. I also feel that, you know, we keep a very close eye on this. The nurses spend most of their day, you know, doing follow-up on COVID. We're very careful, and like if a child who would normally stay in school with a runny nose or a slight cough, they're sent home immediately and they're considered COVID because they've hit a couple of the choice, symptoms. So, and plus, I think with the kids wearing the mask, they're being extremely compliant. They may not be compliant for their parent wearing their mask, but in school, the kids are doing it because it's peer pressure and they're all wearing them. And, you know, I'm sure the teachers get tired at the end of the day saying, please cover your nose. But, you know, I do think it's safe. And even though it is higher in the community, they're in a safe place here. They're safer than they are if they went to Stop and Shop.
Thank you. Dr. Riccio?
Yeah, I agree totally with what Betty said, and it kind of, it mirrors what I just said. Again, the schools are very safe statistically, and right now things are, pretty serious on the outside. So again, my big message is just, you need to respect this. And if I can just prolong my answer a little bit, is listen to the recommendations. Don't travel during the holidays. Don't get into your big family dinners of 15 to 20 to 25 people. I personally have canceled several trips to see my grandchildren around the country, and it was a tough decision to make, but I'm not going to jeopardize myself, my grandkids, or other people for not going by the rules. And the rules have not been set arbitrarily. So I need for you to understand that and just go by the examples we're trying to set.
Thank you. And Bob?
I remembered that time. I just want to, again, thank the community on behalf of all the panelists for their thoughtful questions. I think from my perspective in special services, special education, and work with students and teachers, the unique and critical role that schools play makes them a priority to remain open, which enables students to receive both academic instruction and provide the other critical services and supports that we give kids daily. Thank you.
Thank you. The next question is for Mike, Betty, and Erica. How are we certain without testing children in quarantine that this is not spreading in schools?
I think Mike answered this previously with his information on contact tracing, but for me, and you know,
Oh, you froze, Erica.
families that we're not tying these positive cases to subsequent or prior positive cases in schools. All the positive cases we have had are tied to transmission from the household, from engagement in youth sports, from other areas in and outside of the community where people are gathering in larger groups and may not be wearing masks or remaining socially distanced. So, you know, that the stories behind the contact tracing and the information we gather confirm for us that it's not leading to prior or subsequent positive cases in school.
Thank you.
If we look at our mitigation strategies that we've put in place, the masks, the social distance, the cleaning, hygiene, ventilation, cohorting, they're all working. That's how we control a pandemic. It's not working very well in the community because people in the community, as Dr. Riccio said and others, we got to take this serious. Okay. If people were to social distance and follow the rules with face coverings, and if they're sick, stay home and quarantine and isolate, we would drive these numbers down. In fact, we've done it a number of times. If you look at the models around the state and look at even the country, it goes up and it goes down, it goes up and it goes down. And it's all based on behavior. What we have in school is working, and it's working very, very well. And then again, look at the science, the data, based on looking at hundreds of quarantines, and in our case, because we're a health district, thousands of people that we put in quarantine, quarantines of precaution. Through all the interviewing and contact tracing, we have not seen a single case of spread in any of our schools, not just in East Haven, but across the health district.
Thank you. Nurse Betty? Oh, hold on, you're muted.
Sorry, I lost track of which question we were. I'm embarrassed.
It's okay. There's lots of questions. How are we certain without testing children in quarantine that this is not spreading in schools?
Actually, when students are in quarantine, the nurse or the LPN are following up, you know, with like say a class is quarantined. The nurse will call the other students, maybe not every day, but several times to find out, to follow up with the parent to make sure that their child has not developed it. And that's a way of, that's part of the contact tracing process. But, you know, we do follow through on that, and we're very conscientious about it.
Thank you. The next question is for Mike. Why in some positive cases are there no individuals that have to quarantine?
So through contact tracing, if someone tests positive, what we do is our team and the school district team, we look where that person has been. And we look for significant exposures based on the guidance from the CDC and the state. And a significant exposure determines who goes into quarantine. So just because someone's positive doesn't mean everybody needs to go in quarantine. So what we do is we interview people, we look at where they've been, we look at seating charts, we talk to them, we talk to the teachers, and we decide who goes in quarantine. And in some cases, only a few people go in quarantine. In other cases, many people may go in quarantine, including a full class. And so that's done through the process of contact tracing.
Thank you. The next question is for Erica. Why do we find out a student is positive so long, sometimes over a week after the student was last in school?
Such a great question and a little bit of a frustration point for us, but it has to do with the gap in time from when the child wasn't feeling well, left school, was able to get a test, got the results of that test, and then reported those results to us. And in some instances, that it's up to a week. So that we are sending out the letters as soon as we're notified of a confirmed positive case and we have documentation of that. And then we immediately go back and look and see when the child was last in school. And then our contact tracing starts from there. So it's really the difference between when the child is feeling well, they leave school, they get a test scheduled, the results come back, and we're notified of those results by the parent, family, and or East Shore Health.
Thank you. The next question is for Nurse Betty. How are the isolation spaces working in schools and who staffs these spaces? And you're muted.
I'll explain
Sorry.
a little bit about what they are because maybe not everybody knows. Typically when a kid is sick, they wait in the nurse's office to be picked up by a parent if they have to go home. The state over the summer decided that it wasn't a very safe thing to do to keep kids who have COVID symptoms in a room where kids with non-COVID symptoms would be coming. So the schools were tasked to set up certain isolation areas in every school. Our school district is very fortunate in that we're using LPNs to man these isolation rooms because part of the directive from the state was the school nurse could not man the isolation room because she would be constantly exposed to COVID. Anyway, so so that's what it is. Usually a small area in the school where it's not around other people or other things with easy access in and out. We will send children there who have any kind of symptom, and the parents will pick them up directly from there rather than, we like to have an exit door so that the parent and the student isn't walking through the whole school in order to exit. The LPNs in each school are the people who man those units. And, even if a kid has minor symptoms, it seems like a cold almost, you'll see the LPNs in there. She's in full isolation garb with gown, mask, goggles, or a face shield. And because we do take it very seriously. I hope that answers your question.
Thank you. The next question is for Dr. Oldfield, Dr. Riccio, and Mike. We know children are often asymptomatic carriers, so how can you be sure they aren't then spreading the virus both in the community and upon their return in school without testing them?
Yeah, what we've noticed at Fairhaven Community Healthcare, which is similar to what I think has been noticed really nationwide, is that when we do contact tracing, so when we notice a positive case and we try to find out where that person may have gotten infected, the most common mechanisms of that happening, of infection happening, are not from child to child, but it's usually from situations like going out to a restaurant or a bar, or other forms of gatherings like that. And more often than not, children are getting infected by their parents or their guardians. And That's not 100% of the case. Certainly a child can spread it to another child. But this is an active area of scientific research, is figuring out why kids don't tend to spread it from one to the other as much as other older individuals do. And it may be something about children's immune systems or the way the virus sticks to their cells, but there's something unique about children that makes them less likely to get the infection and, as a result, less likely to spread it.
Thank you. Dr. Riccio?
In my office, when I see a patient who's positive with COVID, I will interview them along with telling them their test results. And as Dr. Oldfield said, usually the scenario I hear is that a child came in, or a student came in from college, infected the parents or the grandparents, or one of the parents just going to work and doing what they normally have to do, have brought the COVID into the house. And that's how the child, student, is getting infected, that are still in high school and below. I have absolutely not seen many cases at all, or any cases at all, where the child was the first person
Niño fue la primera persona
to bring the infection home.
en traer la enfermedad a la casa y afectar a la familia. Él no lo ha visto en absoluto. Lo que él usualmente ve es que es el papá, es personas de fuera, y son los que esparcen esta enfermedad a la familia.
That's what I'm saying.
Thank you. Mike? You're muted, sorry.
How's that?
Better, yes, thank you.
Yeah, okay. So
And we can hear you much better now too.
yes, I adjusted another setting, and I guess it's working better.
Thank you.
All right, you're welcome. So based on what Dr. Oldfield and Dr. Riccio said, the science has said and has proven that it's just not spread, and is a protective factor with young, with our youth. You also have to look at the mitigating factors, right? So we have masks, face coverings are working, the social distancing is working, the cleaning, all the things that we're doing. So even if someone does come in asymptomatic, we're not seeing the spread. There seems to be a protective factor. I know the CDC is looking into it to figure out exactly what that is. But again, we're just not seeing the spread.
Thank you.
You're welcome.
Sorry. See, Betty, there's lots of questions. Even I just lost my place. Sorry. Okay. The next question is why? If there is an in-school transmission, will the district close down and go to full remote learning? This question is for Mike and Erica.
That is an excellent question. So can you hear me?
Yes, perfectly. Thank you.
So if it was a isolated case, we would assess. If it's widespread, we would recommend that we would need to pause school. It's as simple as that. So if it's isolated, we would assess it, and as long as it was contained, we would learn from it and ensure it didn't happen again. But if it was widespread, then we would have to reassess and make some decisions.
And again, I would just add that that is absolutely one of the factors in sort of data points that we would use in making those determinations as part of selecting a learning model.
Thank you. The next question is for Mike, Dr. Riccio, and Erica. Do you think it's helpful to go full remote for 2 weeks after Thanksgiving? Mike, you can go first.
Mhm. So that's been floated around a lot. And so I'm part of a committee with the State Department of Public Health and the Department of Education. And we talked about this in length. We looked at the data and we determined, and it's actually, I'm looking at the memo right now that was issued by Commissioner Cardona and Commissioner Gifford from the Department of Public Health and Department of Education. And it was determined that unless there is a reason, a public health reason, there is no need to close school. It doesn't add any value. If anything, it's going to be more disruptive to our families, to our students. And so the recommendation, and I'll read it verbatim, that the state is not recommending that districts proactively close for a prolonged period of time in anticipation of changes in the disease prevalence. And so basically what that means is unless there's a reason, a public health reason, a safety reason, it is not necessary to close for 2 weeks.
Thank you. Dr. Riccio?
From what I've seen, and the biggest thing I've seen is that during the Halloween break and parties, the docs and my colleagues were kind of predicted, okay, after these parties, we're going to see an uptick in 4 to 14 days after everybody had their parties together. And this has coincided with a lot of our predictions. Having the students home for vacation, Thanksgiving and Christmas, they're going to be associating with more people, or hopefully not more people, if we take it seriously and don't have big, huge gatherings for these holidays, that they won't get infected from the outside world. Closing the school, in my mind, you know, I don't have the statistics for it, but empirically, what I feel and think is that keeping the students home for a prolonged length of time is going to, I don't have any statistics about this, but it seems they're going to have more exposure in terms of being with their friends and larger parties. I would think it'd be contradictory to what we're trying to accomplish in keeping the students safe. And that's just my gut feeling about that. I don't have the statistics, but I think what Michael said, you know, they're developing a model, and basically we're going to kind of learn from what's going to happen. But that's basically what I can tell, is just what I think and feel may happen. So I would not want the students to be out of school for that length of time.
Thank you. Eric?
So I was going to reference the same memo that came out on November 10th that Mike did from Commissioner Gifford and Commissioner Cardona. I'll just add that they said that the CSDE and the DPH do not think that arbitrary date-based closures of school are warranted at this time.
Thank you. The next question is for Betty and Mike. What is going to happen when it gets cold and students need mask breaks? Oh, Betty, I can unmute you. Sorry. There you go.
Hi, there's no reason the kids can't still go outside for their mask breaks if they're appropriately dressed with a coat, hat, and gloves. There are charts that factor in wind chill and all that stuff as if it's safe or not, and how long it's safe for the kids to be outside in the winter. And most of this, all of schools have those charts that they refer to before allowing the children outside. But they don't have to be outside running around like recess. Just a quick little walk outside with, you know, with the mask off, socially distanced. that's what's important. And it's important to make sure that they're dressed appropriately with warm clothing. And, you know, I know that there's always high school kids who want to wear shorts or whatever in the middle of December, but, you know, it's as a parent to encourage your children to dress warmly, bring a hat, gloves, and coat.
Thank you.
And I just want to echo what Betty just said. I mean, folks, we're New Englanders. This is what we do, right? Going outside in the cold weather and playing, you know, myself, I'm sure the mothers and fathers out there would agree. I mean, that's what we did when we were kids, right? So they're going outside now. We're going to continue. And yes, it's cold, but if you dress appropriately, it's fine. In fact, it's refreshing. It's healthy.
Thank you. The next question is for Dr. Oldfield. Will Fairhaven be setting up any more testing sites at our schools for anyone to get tested?
Yes. So we've really taken it on ourselves at Fairhaven Community Healthcare to try to get testing into various communities that need it the most. And so in East Haven, this has involved the East Haven Senior Citizen Center, Bella Vista, and then the schools as well. And I think schools are great places to do testing if we pick the time right, so that we get people who, you know, they know the schools. Schools are a trusted community hub that I think people are willing to come and get tested at. And so we love partnering with the schools to be able to do that. And I look forward to working with Mike to think strategically about, you know, where and when we can do that to get testing into the communities that need it the most.
Thank you. The next question is for Dr. Riccio, Dr. Oldfield, and Mike. With flu season approaching, are there concerns that the flu spread in school mixed with COVID can create a larger issue? Dr. Riccio.
Or maybe a more confusing issue. Yes, you know, you're gonna, you know, the COVID symptoms are pretty much alike as to normal flu symptoms. The COVID symptoms have a couple little extra caveats to it, but basically, what we're going to try to do is that if someone has flu-like symptoms, we now get COVID testings as fast as possible. What may be set up in the hospitals is that you can get a flu A and B test along with your COVID test at the same time to try to differentiate what these flu symptoms are from, and then appropriately treat the flu as we have done in the past. What I've seen in my office is that people who have never had a flu shot are getting flu shots. We've given out more flu shots at this point in time than we ever have in the 40 years I've been around. And so I think that's going to help cut down the incidence of the flu. We're going to try to be able to differentiate who has flu, who has COVID. And that's going to be the best we can do to try to help with the appropriate treatments of the three diseases: flu A, B, COVID, and the billion other viruses that are floating around.
Thank you. Dr. Oldfield?
Yeah, I agree with Dr. Riccio that these are oftentimes difficult to distinguish. And for that reason, we're going to be doing, alongside that rapid testing for COVID, we're able to do rapid testing for flu as well at the school-based health centers, so that we can be thoughtful about that distinction and make a diagnosis in the moment. I will say also that on the upside, what we've seen locally in the Fairhaven community, as well as some other countries that have already gone through their flu season, let's say they're in the Southern Hemisphere, is that the flu season hasn't been as severe as in prior years. And people think this is the case because we're more mindful of the spread of disease now. More people are obviously wearing masks and engaging in physical distancing and washing their hands more. And those measures are extremely important, not just for COVID, but also in preventing the spread of flu and all those other respiratory viruses that Dr. Riccio mentioned.
Thank you. And Mike?
Yes, I would agree. One, we give flu shots out with the health district, and we're giving more flu shots than we ever have, and that's the case across the state. And so more people are vaccinated, and because people are following the COVID-19 rules of social distancing and masks and good personal hygiene, the rates are down. And as Dr. Oldfield said, you know, if we look at the Southern Hemisphere and how it has panned out, the rates are lower. So for all the reasons that they outlined, while it's something to look at, and we have a plan, as Dr. Oldfield said, we're just not seeing large flu outbreaks this year.
Thank you. The next question is for Erica. I sometimes can't spend extra time with my child doing work, and sometimes I just don't know how to help them or what their work is about. Is there any extra help for remote learners who need extra help?
So, you know, as a parent, I totally understand this dilemma. Absolutely. You know, we just want to remind parents that the best thing that we can do to help our kids is to just set up a safe place for students to work and have a consistent routine. You know, we are offering an extended day remote support opportunity, and you can contact any one of our extended day remote coordinators. Julie Church is at the K-5 level, Janine Fiorello is at the 6-8 level, and she's also at the 9-12 level. So we do extra tutoring, supports for parents, supports for students, and we're also working with our teachers to help make the work manageable and easy accessible in our online platforms. So, you know, we understand the struggle and it's really challenging, but, you know, behaviors with good routines and reaching out to your child's teacher as well as our coordinators to get support through the extended hours is what we would recommend at this time.
Thank you. The next question is for Bob. It feels as though our district failed to retain teachers that requested remote learning accommodations due to having high-risk COVID factors. How are we filling the gap?
So I could speak to this in a general sense. We did not lose many teachers for that reason, for the reason that we were unable to provide them with accommodations. In a general sense, the Americans with Disabilities Act requires this office, us, administration, to engage in a good faith interactive process with employees who have a disability to determine effective and reasonably implementable accommodations. We have been able to successfully do that. In many cases, we have either initiated follow-up with those individuals who have requested accommodations or have responded quickly to their additional requests to ensure that staff are comfortable. It is of importance to us that staff feel comfortable and safe in our schools so they can provide the same level of care and security and educational opportunity to our students that we would expect under ordinary circumstances. Thank you.
Thank you. This question is for Erica. Breakfasts and lunches for those that live in the center and do not drive, shouldn't there be a location or should there be a location at Overbrook or Tuttle for pickup?
So we currently have locations in the center at Joseph Malillo Middle School and the high school. If we go full remote, we most likely will extend the food pickup to Tuttle or Overbrook as well, and potentially add Mamaguin for additional sites so that we can handle the increased traffic for parents picking up both breakfast and lunch for children on a daily basis.
Thank you. Next question is for Betty. Can we be sure that cleaning products being used are safe for our children?
Yes, you can. The state of Connecticut regulates what cleaning products, type of cleaning products can be used in schools. They have to be green for the environment and safe around children. But also, once COVID hit, they included some more products that were more effective for COVID. And but they're still all safe to be around children. Like some of the wet ones are almost, I'm trying to think how to describe this, almost like a diluted, not bleach, but like a cleaner, so that when they spray it, it's wet. And then when it dries, it's safe enough that you could lick whatever you sprayed as long as it was dried and nothing would happen to you. They're that safe. And if it's wet and you touch it, it's just like a very light bleach kind of stuff. It's not bleach, but it's that type of thing where you just have to wash your hands and it's gone. It's not sprayed and left wet around the children. Okay, and that's what they use for the disinfecting for COVID and things like that. I'm assuming that's where this comes from. All of the products that are used in schools, they have to have forms of what to do, with skin contact, drinking, any kind of thing that could possibly happen. But for what we do now, spraying with the spraying and stuff, it's very, very safe.
Thank you, Betty.
Mm-hmm.
Mike, did you want to add to that?
Yes. So everything Betty says is correct. Also, within our plan, we talked about the different cleaning products, and every product that we're using is EPA approved. So no products are used in our schools unless they're EPA approved.
Thank you. The next question is for Erica. When will the district be sending out another survey to collect feedback from parents?
Great question. If you didn't already receive one today from the building principal, you should receive one tomorrow. We've just completed putting a survey together for parents of across the district, regardless of whether you're a remote learner or an in-person learner, in an effort to continually keep collecting feedback and making adjustments and improvements in our programs. So be on the lookout for that survey. We're also in the midst of putting the final touches on a staff survey that will be circulating very soon. And then finally, we'll be circulating a student survey for students in grades 3 through 12.
Great, thank you. The next question is for Mike and Erica. Why don't we close schools for deep cleaning after a positive case?
That is an excellent question. And the reason why we don't do that is because our cleaning procedures are already enhanced. We already have an excellent cleaning program. And so there is no need for enhanced cleaning or a deep cleaning. Now, that said, we certainly will look at the area and let the custodians know, maybe do a little focus cleaning, but for the most part, it's not needed because it's already enhanced.
Thank you.
I'll just further add that, in some cases, and there was a question that alluded to this earlier, the student was last in school on the 5th, and we find out on the 10th that they're positive, and 5 days have gone by and that building and area has been cleaned every day routinely 5 times. So I think the confusion when we first started having positive cases across the state is that schools were closing. It wasn't so much for cleaning, but it was more in an effort to have more time to do contact tracing.
Thank you. This next question is for Bob. Is there any talk about keeping the special needs learners, specifically elementary school ABA classrooms, in school in the event of full remote learning? And if not, what would the metrics be for in-person learning for these kids to continue?
What a terrific question. If you'll recall, this summer, we actually brought our most disabled learners back for 6 weeks, 8 weeks of instruction during extended school year services. So we have every intention to make every effort for special education services to take place on school grounds, but it will have to be consistent with current health and safety guidelines and guidance from the federal, state, and local authorities. East Haven parents will still have a choice about whether they want their children to attend those programs or not, in-person programs, but it would behoove us to keep those kids coming to school if we can.
Thank you so much.
Thank you.
The next question is for Erica. This is a long one, so sorry. We need a robust remote music program using instruments such as small keyboards, ukuleles. The music teacher lesson was disconnected 5 times in one session due to poor connectivity, along with the connectivity issues that happened this Monday with Google. Why is this happening, and how can we ensure this will not happen if we go full remote? Oops, sorry. I muted you by accident.
All right, that's a great question. I'll take it in 2 parts. We've had to make a lot of adjustments to a lot of our programs, music being one of them. And we have invested in different types of instruments that are safer. And our teachers have done an amazing job coming up with innovative strategies and ideas to engage kids in music class without putting them at greater risk. So, you know, you can anticipate seeing some ukuleles or some banjos in music class, some different types of wooden sticks and bells and things of that nature. So the second part of the question had to do with connectivity. So the connectivity issue on Monday really was the result of an issue with Amazon Web Services that affected a lot of districts and other customers. It's been rectified, and we don't anticipate any further problems related to that specific issue. But we can't promise that we're not going to have another issue. You know, Google Classroom and Zoom video conferencing are experiencing a record use across the US, given the number of school districts and systems that are engaging and using those platforms. They're growing their capacity to meet the need, but we cannot ensure that the connectivity issues will not continue in the future. Our tech support team is available to help and troubleshoot and communicate any issues with Zoom, Google Classroom, or anything else, but we're really asking for everybody's patience in this area. Is, you know, some tech issues are within our control and we have the capacity to rectify them very quickly. Some are not, and you have to depend on Google and Amazon to rectify it on their end before we can restart it in our own district. But we also have solutions for families that may have insufficient bandwidth at home. So we have vouchers from Comcast Internet Essentials, and we have Kajit cellular wireless hotspots. If any family is in need of more robust internet connectivity or greater bandwidth, you can contact Julie Church for more information.
Thank you.
You're welcome.
The next question is, what can we do as parents to support the schools? And this question is for everyone, so I will kind of go down the list again and just, I'll hit the ask you to unmute button when it's time for you to speak. So let's start with Dr. Riccio.
Boy, there's a lot you can do. First of all, set an example, be an example. take this seriously. Do not have large Thanksgiving parties. Don't have large Christmas parties. Cancel your plans to go on trips, especially planes. The way the flu year after year goes around the country is with our jets. And wear your masks in the stores, and wear them properly. The mask goes over your mouth and it goes over your nose. You know, wearing your mask with your nose showing, you're still spitting out every virus known to man and not known to man. You know, I heard a statistic, and who knows if what you hear is correct. I heard a statistic that if 17% more people wore their masks, the COVID statistics would be cut down tremendously, if not even cleared up. So that's the whole point. Listen to the suggestions and be serious about them, and just be responsible.
Thank you. Nurse Betty?
One of the things I could say is that's, and we all know this, it's really important. If your kid is sick, keep them home. Even if you think they have it's just a little cold, it's nothing. And with this atmosphere, we need to stay home. And if you do keep them home, call the nurse and let them know what's going on. And they can help you make a decision on if you need to see the doctor or what to do. Also, the students are anxious, the parents are anxious, the teachers are anxious, everybody is. And so just take a breath, and we'll all get through this together by working together. And ask your teacher what you can do to help with the classroom. One of the things you may not know is that we're supposed to keep the classroom windows open. So send your kid with an extra sweater or a sweatshirt in their backpack or something that they can put on if they get cold in the classroom. So there's little things that you can do, and just call the child's teacher and find out what you can do to help them to make it an easy process.
Thank you. We missed that. Do you want to say it again?
Make your child get a flu shot. That's the most important thing. Okay, thank you.
Thank you. Bob?
Oops, I was clicking on the wrong, I was clicking on the mic button, wrong mic button. Again, like Dr. Riccio, we could go on for hours with this, but I'm going to take it from a standpoint where for the next 9 months and then the rest of your child's lives. All right. So express your love and confidence in your child's ability. Convey the importance of academics for achievement in future opportunities and success in life. Encourage your child to struggle a bit before you jump in and intervene, and then praise them for the hard work. And make sure you build in some time to have some fun, play with your kids, get out there and roll around a little bit, get involved in some high interest activities. And the three things that Erica and I always shout at each other and all our staff: hydrate, eat well, sleep 8 hours. Thanks.
Thank you. Dr. Oldfield?
I think we've spoken a lot about the risk of COVID, and Bob and Betty, your comments made me think about another risk that we need to be thinking about, which pertains to mental health. And I think we're all feeling stressed by what's going on. There's a lot of uncertainty. This crisis has been going on for a long time. We're getting a little tired of it. Isolation impacts us all. And it impacts us in emotional and behavioral ways. And so I would encourage parents to be aware of that. And, you know, children sometimes don't tell us that they're being impacted in social and emotional and behavioral ways, but they may show that they're withdrawing, or they're more fearful, or they're acting out. And I would just encourage parents to take note of that and seek help. There's resources in the school, there's resources in the community to engage kids in various kinds of activities and mental health treatment.
Thank you. Mike?
So that's an excellent question. Our town, our health department, the school district, the mayor, his staff, all the departments, we're doing everything we possibly can do to keep our community safe and to control this pandemic. We're not going to stop it until we get a vaccine. And sometime in the near future, we're going to have a vaccine, and we already are working our plans to vaccinate our population. But folks, we can't do it alone. We need your help. And the first thing, and you heard it from others, and I never thought I would say this. I've been in public health for 30 years now, and to tell people, don't get together for Thanksgiving. It's one of my favorite holidays. It's a real holiday where people get together and share things and talk to your family and friends. But this Thanksgiving, it has to be different. And the holidays moving forward have to be different. Because if they're not, we're going to continue to see cases increase. And I sincerely ask every family to do their part. There's no magical answer to control COVID-19. It's very simple. Wear your face coverings, social distance, spend more time with your family, and look at the opportunities. And, you know, that's what I've done with my family is, you know, this isn't fun, and I'm not going to pretend it is. But there are opportunities to spend more time with your family and be creative. And you have to look in every situation, the opportunities, and there are opportunities here. And it will pass, you know, very soon in the future. This will be a thing of the past. But for now, we all need to hunker down and do our part. And we cannot do it alone. We absolutely need your help. So please do your part. Enjoy the holidays. Just have a different kind of Thanksgiving.
Thank you. Perhaps some Zoom Thanksgiving get-togethers.
Yes, exactly. Make the best of it.
Yes. And Erica?
So I keep going back to this, something that resonated with me that Commissioner Cardona said at the very start before we even opened schools. And he said the only constant is going to be flexibility and remaining flexible, right? We need to continue to partner and work together to get through this the best that we can. And so I just encourage parents to get accurate information, use the datact.gov portal to keep up to date with the data. And if you have a question on something, go get the facts or reach out to us, call us, email us, and let us know how we can support you and your children. That's what we're here for. Thank you.
Thank you. So I just want to say thank you to all the panelists for your time answering questions submitted by parents and guardians. And thank you to everyone who joined us tonight. We hope we were able to answer some of your questions and hope you feel a little bit better about everything that was covered here today. A recording of this panel discussion will be available soon on our YouTube page. Also, our East Haven Public Schools website is being updated daily, and our calendar and events and our main page and our COVID page have been redone to make it easier for parents to find the information they're looking for. And with that, I just want to say thank you again, and I hope you all have a great night. Thank you.
Thank you, everybody. We appreciate your partnership. And thank you, Melissa, for facilitating.
No problem. Good night.
Have a good night.
Good night. Bye, folks.